Let's start with a definition that you can kind of hang your hat on. The definition of developmental trauma is really anything that interrupts or interferes with the normal developmental processes of social development, emotional development, physical development, cognitive development, and language development. Any of those things that are interrupted or interfered with can be developmentally traumatic. Now, you'll have a really good understanding by the time that we're through tonight about why that is true. The reason we are concerned about this is because when that level of dysregulation, in other words, when those interruptions or interference occur on a regular basis, these are the behaviors that we start to see in people. We start to see depression, mood disorders, anxiety, suicidal ideation. We see a lot of health problems. We see increases in things like allergies and colds and infections, and we see people with more repressed or suppressed immune systems. We see increases in physical aggression, emotional aggression, impulsivity, delinquency, hyperactivity, obsessive-compulsive disorders. We begin to see high rates of truancy, vandalism, alcohol use, early drug use, a lot of youth exiting the home before they are 15, and of course, substance abuse or addictive behaviors of all kinds, and a host of other antisocial behaviors. Now, these don't go away when a kid turns 18. If these things are in place, guess where they carry them to? They carry them into maturity. And this is not a great thing for a lot of folks. Let's talk about some of the problems. When these environments, and we're going to go through the specific environments a little bit later, but when these environments trigger these states, particularly in a young child, when the child is wiring their brain. Remember, the brain is use dependent, so it develops as it's used. So if you are in a chronically dysregulated family, very chaotic environment, what's being wired into you is how to use your system that's always on alert, that is always emotional, that is always hot. And we'll talk more about that a little bit later. The problem with that, every child will experience stress, just like every human being will experience stress. Unless they are in a coma somewhere, they will have stress. The problem becomes when the stressors are frequent enough that the child or the adult never gets back to a pre-stress baseline. So essentially what happens is the baseline increases. So they start at a higher range the next time there's a stressor. It's kind of like, think of it as a multi-story building. Most of us can function pretty well on the first 3 floors. But if we're in enough stress that we always start on floor 5, we only have up to go. At some point, if you don't get some kind of redress to this, you're going to be on the roof and jumping off. And actually, when we look at aggression studies, they call this the track to lethality. In other words, you can track the behavior. It increasingly becomes more lethal in nature till finally it's either lethal towards others or lethal towards themselves, which is not a good thing. Part of the concept of this is children are taught to behave by the trauma that they're experiencing. Now, once again, we're not talking about being beat up, sexually abused, neglected, abandoned, while those certainly can be. We're really talking about anything that interrupts with those normal developmental processes. So let me give you a couple of examples of what might be interfering. For example, a 13-year-old that has had 27 different residents in 6 years. You think that might disrupt their normal developmental process? Are they socially going to be challenged? What about educationally? Are they going to be able to, have good language acquisition? Are they going to have cognitive abilities that equal with their peers? More likely not. In this particular case that I'm referring to, obviously not. So we see parents that drag children through serial relationships. Now that gets, when you say something like that in a group of parents, they get kind of irritated at you because you're saying, well, you're saying the reason that they're this way is because of me. And you don't want to say, well, yeah, you're right, because of course that's offensive. But let's be honest, you have had 5 different men live in your household in the last 3 years, and that's a constant state of turmoil. All the research out there about how long it takes a child to adapt. Everybody tends to think, because I want to have sex with this person, my kids will just naturally fall into line. And that's a mythology. What we know is that when we blend a family, it takes between 4 and 6 years for that blending to work well. So a lot of these people are in and out of relationships within 10 to 12 months. There is never a settling. Those are what we would consider developmentally traumatic behaviors. Don't get caught in the word trauma as being only getting your butt kicked, because it's way too narrow. Brain development is use dependent. In other words, what systems you use get developed more. So think of the neural system is activated. So if you're living in a house where there's constant screaming and arguing, what's getting wired? This is the way to have an interaction with somebody. This is not only picking up the habit of how to do it, but we're wiring the brain to respond to those kinds of stimulus. And there's a rule which we call Hebb's rule in neurobiology, which means those things that wire together fire together. Every time we add another stressor that's similar or in the same neighborhood, if you will, of the ones we already have there, we just enrich the activation process of these problematic thoughts, problematic behaviors, and problematic neural reactions. Because what we're wiring together will fire together. So let's begin the process of looking at the brain. The brainstem. The brainstem is a wonderful little part of our brain that sits right on the top of the spine. It's the first part of the brain that's formed. It's probably considered the most primitive. And it's more or less like the power plant in a large factory. It controls the sewage, the water, the power, the electrical access, how the cooling, the temperature, everything that's handled in a big factory is usually handled through a physical plant of some kind. You can think of the brainstem as being a physical plant in that way. Its job is to help regulate the basic biological functions. So let's talk about some. Temperature. Do we want your body to stay within a certain range of temperature? Now, we have what we consider the human normal, right? But you realize that most people are within a degree either way on a normal basis without having it be a temperature. You know, some people have a lower resting temperature than others. Some people have a little bit higher. Not a concern, but when it gets to be extreme, we got problems. What about water movement or waste removal from your system? Is that important? And what happens if your sewer backs up? You know, there's not a handy plumber we can send in there to fix these things, okay? Blood pressure, blood flow, all come out of that, all are initially controlled out of that brain stem. When they say state memory, this is what we might also call a range memory. So what is the normal state? If you exercise, what happens to your physiology? Do you change blood flow? Do you change hormones that are in your system? Do you change your breathing? Right. But when you stop, you should return to the pre-exercise baseline. So the brainstem is the calibrator, if you will, of the basic or the base range of reactions. When it's dysregulated, we get things like hypertension. High blood pressure is actually a dysregulation in the brainstem, meaning that it has been somehow, either through some physiological change or through chronic stressors, it has actually reset the baseline for you. Because always having to bring you down to this baseline is kind of a work, so they'll move the baseline up, which then means you get a faster heart rate, you get to go to the doctor and get medications to lower that, and a lot of people that have, chronic work anxiety tend to have high blood pressure, so we have a lot of it in community services. So that's kind of the memory that's there, what we call state memory. So these are the things. Let's just review real quickly. Breathing rate, breath volume. Does everybody know what a galvanic skin response is? That's how fast nerve transmissions go across your skin. Okay? That's the mechanism for a lot of our lie detector stuff. Okay? Heart rate increases, pupil constriction, increased adrenals in your system, suppression of the immune system, and a change in blood flow. All of these things can be dysregulated by the brainstem based on stressors. Okay? Chronic stressors will get chronic dysregulation. So, why is this a problem? Well, because you become more focused on survival mechanisms. Somebody that's chronically dysregulated will probably be hypervigilant, which, of course, if you're already having trouble relaxing and getting back to that pre-baseline state, is now going to be even more difficult. You're going to tend to overreact to mild stressors. You're going to probably have an increase in emotional volatility. This doesn't mean that you're going to react to things differently, but you're just going to react more intensely to them. Particularly challenging emotions. And then poor ability to learn from experience. One of the side effects of having the brainstem dysregulated is if you think of it this way, you're dumping enough junk into your neurobiology that it interferes with you encoding new experience. So what happens is, instead of having a total experience, you may only encode 60% of it. Well, what happens to the other 40% that you don't encode? Is it not important to know? Maybe it is, maybe it's not. I mean, we don't really have to pay attention to the fact that the air conditioning is running in here. We can kind of ignore it. But there's a lot of things we really don't want to be ignoring. And with folks that have chronic dysregulation of the brainstem, they frequently don't realize that they've missed a significant amount of information somewhere.